Hello, I'm Glenn.
And I'm Brent, and
We are the Penumbra Brothers. We focus on you.
Hello, it's Brent again, one of the Penumbra Brothers. We're going to be talking about sunrise or merchant views of the knees. There's lots of different ways to perform these. I've got my favorites, but we'll talk about three today. We'll talk about the Setagast, Houston, and merchant views. Those are probably three of the most common. So this is a Setagast view. I'm going to turn around here just a bit. We have the patient actually supine, holding the IR. We actually have the tube centered so as to just skim tangential to the patella. I look at the shadow on the image IR quite a bit with this. I'm going to move this up just a little bit so I'm kind of the center of the IR, just like so. A lot of people have the patient sitting when you do this. Go ahead and sit up for me, Nikki. The reason I don't like people sitting is pretty obvious, right? We're aiming right through the IR, through the patella, through the IR, and right at her corneas and her thyroid. So you really don't want people sitting up and holding the IR like that. You want them laying back. Okay, so that's the Setagast. Okay, so I'm going to have you now roll on your stomach for me. Maybe bend your knee up for me. Bring this down when you rest your foot actually on this tube. Bring it up a little bit more, and then I'm going to have to rest your toes right there. Good. There. Okay, this view is another view of the patella called the Houston. We actually have the tube angled again about 40 degrees. Angle in this case around 40-degree angle. We're skimming again tangential to that patella. I've actually got my IR in the bucky right now. We can actually rest the patient's foot right on the tube of the column itself. Again, another variation of the sunrise view called a Houston. So this view is another variation of sunrise view called the merchant's view. This is a view that's used very, very commonly by orthopedic surgeons. It determines not only the position of the patella, but also position of the patella in relation to the femur, which is super important. We're looking at patellar tracking problems and anterior knee pain. So again, this is a view where the patient's supine. We use a special device called a merchant board. The patient's legs are resting in. And if you come around here to the side, you'll see those patellas. Again, my central ray is just skimming those patellas. I'm going to calm in just a little bit more. Got my right marker there. I'm just going to skim right over the top of those patellas. We're centering actually in between both patellas. And in this view, we're actually able to see where those patellas are. I'm going to take this off, Mickey, here before it bugs your shins here. So the idea of this view is that you can notice that they're only at about 30 to 45 degrees. And in that position, that mimics where the knee angle is when people are playing sports, running, hiking. We don't typically do exercising when we're hyperflexed. Most of the other patellar views, we have the knee in a hyperflexed position. So this lets us see where the patella really lies during normal activity. Most people, if they have some subluxation or tracking problems, patella will rotate kind of outwards. It'll be hanging out here. So this is a really good view to demonstrate patella tracking issues, more than just seeing the patella itself. Thanks, and be safe out there. Thanks for watching. If you like what you saw, hit the subscribe and notification button. See you soon.